Go on depth on this story, the scourge of Ebola, the threat to Africa, Asia, and perhaps North America. Dr. Sanjay Jain, the board certified physician and author of Optimal Living, joins us to talk about this. Doctor, as Miranda just reported, a fourth American being flown to Emory now. I believe 3 have been treated in Emory, 1 is being treated in Nebraska. The prognosis for his treatment likely successful?
I think it's got a great prognosis. He's under great care, and so I'm very comfortable with what they're doing at Emory. They did a great job with the other 2 people, so I'm very comfortable with that.
A lot of people want to know, will he be treated with the same experimental drug as Dr. Brantley was?
He probably will, and I think they're going to go through the same regimen. You know, if it works, don't if it's not broke, don't fix it. So they're going to probably do the same regimen.
Sanjay, this question continues to come up. Doctors go into the field. A lot of doctors who serve as missionaries going into Africa. Is it too risky now for physicians from the United States and elsewhere in the Western world to be in Africa trying to fight this disease?
It's absolutely risky. And, they are very understaffed in Africa. In Liberia alone, they probably have 1 doctor for every 100,000 people. That's pretty low. I mean, that's pretty shockingly low in terms of the amount of healthcare or lack thereof in Liberia. And to go in there and to have the same, or hopefully have the same kind of conditions would not be a good situation for the doctors. I really think that, these healthcare workers coming in is really going to be a problem, and that's a concern. So now they're talking about the military coming in and trying to help out. So there's a lot of logistics that have to be solved.
Is it risky but necessary?
It's risky, but given how much this has exploded, it is necessary because of the lack of healthcare workers available. I mean, they're dying. We had 152 workers, and I think out of 79 died from the Ebola virus in Liberia. So it's risky. They have to take very strong measures. They have to get good, proper training in terms of getting in there and try to practice good technique. And that's, there really isn't a choice because it's really going to be spreading as wildfire.
Dr. Jain, a lot of people are concerned. We're hearing about physicians contracting Ebola. A lot of people keep saying it's very difficult to get this disease, but these are people who are actually trained in disease prevention, yet they're getting it. How is this happening?
That's tough to say. And, these physicians are well trained, and a lot of times they're not even aware that they were exposed. And so you almost have to take the assumption that you are going to be exposed, and you really have to be careful who you're in contact with, because this is a disease of contact. So you have to be very careful, and stringent hand washing, double gloving, wearing the proper gowns. It's very important. So they're getting the training, but unfortunately what's happening is that it's going to unsuspected patients, and and the doctors are dealing with that. So you have to work on the assumption, especially in Africa, that everybody's got Ebola, and you have to take this massive precaution.
Dr. Jain, you used an expression a few minutes ago that we better put in context here with the less than 2 minutes we have remaining. You said Ebola is, quote, spreading as wildfire.
Yeah,
now, are you confining your comments to the continent of Africa in this case?
Yes, at least in Africa, but it's a fire that, it's just like we have our fires in the California. You try to put them out, and then you got one little area that picks up and it just blows up. And that's kind of what happened. We had a small window of actually optimism where things were actually looking pretty good, but then you had 1 or 2 stray people who went beyond quarantine and spread the disease. And so, it's a wildfire. That's how I call it, because it's something that has to be contained. We have to be very aggressive. And it's very serious, because if you don't contain it within these countries, it can spread in other countries in Africa, and who knows when it can reach our borders.
Well, and this becomes the thing. About a minute left. This wildfire, in your opinion, can come to the American continent, can come to our country. How concerned are you that it shows up here?
I'll admit, a few weeks ago I wasn't as concerned, but my tune has changed. It's very concerning. I'm very comfortable with the healthcare here, but because of how we're all interconnected globally, it's a big concern. These aren't just villages. We're talking about big cities in Africa, and there's a lot of airports. that are connected go to Europe and can go to America. So yeah, it's a big concern.
Dr. Sanjay Jain, we appreciate your candor about the concern you have now about Ebola. We look forward to having you back to continue to monitor this.